Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the non-invasive test. Non-invasive test to diagnose hepatic fibrosis. The non-invasive test to diagnose hepatic fibrosis include: 1. We have FibroSure. This include FibroSure or Fibro test. FibroSure on Fibro test. This will incorporate haptoglobulin. This will incorporate haptoglobin, bilirubin, GGT, apolipoprotein A1, okay, alpha 2 macroglobulin. Okay, it will also show high levels of positive and negative predictive values for diagnosing advanced fibrosis. Positive and negative predictive values for diagnosing advanced fibrosis. Okay, then the third test is second test, important test is fibroscan, or it can also show transient elastography. Fibroscan or transient elastography. What does this do? This will evaluate hepatic stiffness. Fibroscan or transient elastography will evaluate hepatic stiffness. Okay, then third, it is magnetic resonance elastography. Magnetic resonance elastography. Okay, so these are the main non-invasive tests of the hepatic fibrosis. Thank you for watching.
Thank you and thank you for watching.